Hi, I'm Lisa Capps, nurse practitioner from VCU Cardiac Surgery. Welcome to Virginia Commonwealth University Health in Richmond, Virginia. Today we will be discussing preoperative cardiac surgery information. On the preoperative evaluation day, you will meet your surgeon and possibly the advanced practice provider. We will discuss the need for surgery and the basics of what is involved with the specific surgery. Additionally, we will discuss what will happen in surgery and during the hospitalization day. If you agree to surgery, we will sign consent, and you may even obtain the date of surgery. You will get lab work, chest x-ray, EKG, a MRSA screen, and a urinalysis done the same day. You will be taught how to use the incentive spirometer. This is a small breathing apparatus to help expand your lungs. You will use postoperatively. You will be given a decolonization kit used to reduce resistant staph infection. This kit includes mouthwash, body wash, and a nasal ointment, and the directions on how to use each for the 5 days before surgery. You will be given dates, times, and places to be, along with the hospital campus map. On the day of surgery, you will arrive at the Gateway Building, 1200 East Marshall Street, to the valet parking at your instructed time and proceed to the 5th floor. The time of arrival will be between 5 and 5:30 a.m. for the first surgery of the day. Additionally, we will discuss medication instructions, like when to stop certain medications for the surgery. You will be given the date and place of where to get the required COVID testing done at VCU prior to surgery, even if you have been fully vaccinated. And finally, if you are interested in our hospitality house, we can give you information at this visit. The hospitality house, called The Doorways, is a hotel-type setting used for the patients and their families or significant others to stay at a discounted rate during the hospitalization.
Hi, I'm Dr. Kate Klein. I'm one of the cardiac surgeons here at VCU. I'm going to just talk to you a little bit about what to expect both while in surgery and after surgery. While in surgery, you may be nervous the first day. Our goal is to help explain more about your typical day and provide some information to make you more comfortable with the experience. First, you will be admitted to the pre-op area, where a nurse will review your medications, when you last ate, any allergies, and get a baseline set of vitals, including establishing an IV. You will also meet with the anesthesia team that will get consent for an arterial line, a central line, transesophageal echocardiogram, and general anesthesia. These are special IVs that help monitor your blood pressure and provide medications during the surgery. The echocardiogram helps the surgeon determine how well your heart is functioning, especially important if you're having a valve surgery. Some surgeons will also have you receive special pain catheters in your back to help with any postoperative discomfort. And these are placed by the pain management team in the pre-op area. Once you have met with anesthesia, you will then be moved to the operating room where you will meet the surgical team. Once you are on the operating room bed, you will go off to sleep and the breathing tube will be placed. Surgery usually starts about an hour after you leave the pre-op area. During surgery, you likely will be supported with cardiopulmonary bypass or the heart-lung machine. This helps the surgeon to safely operate on your heart while providing support for the rest of your body. After surgery, you will also have some chest tubes that help drain the fluid and air around your heart and lungs, and you may have some temporary pacing wires. These tubes and wires will all be removed prior to going home. Once surgery is complete, you will go to the intensive care unit, often with the breathing tube still in place. This is where you will continue to recover. As soon as it is safe, the ICU team will wake you up and remove the breathing tube. Once you're in the ICU, the team will continue to work to get the breathing tube out as soon as it is safe and work on getting you out of bed as well. It is common that you are asked to work with physical therapy the day of surgery or walk the next day while sitting in a chair immediately postoperatively and work on your breathing tools. The ICU will continuously be assessing when it is safe for you to transition to the step-down unit. While in the ICU, you'll be closely monitored and medications provided to help with your blood pressure, rhythm, and pain. Once stable, you'll be transferred to the step-down unit where you will work even more on walking, eating, drinking, and making progress towards going home or to a rehab facility. Physical therapy and occupational therapy will continue to assess your needs and when it is safe to discharge you. Hospitalization typically lasts anywhere from 3 to 10 days depending on your type of surgery. When the team has decided you are safe to be discharged, all the wires and drainage tubes will be removed and previous IV lines will also be removed. Physical therapy will have provided their recommendations on the need for home therapy versus facility monitoring. This may include having in-home physical therapy several times a week for several hours versus going to a rehab facility to continue your healing there. If you are discharged home, you'll be encouraged to continue walking multiple times per day and to continue use of your pulmonary tools. The bedside nurse and advanced practice team will go over your discharge instructions with you. This will include all your medications, what to take, when to take them, and what the medications are used for. Prescriptions can be sent to the VCU pharmacy or to a different pharmacy of your choosing. Restrictions after surgery will also be discussed, including no driving for several weeks after surgery, no heavy lifting, pushing, or pulling, and no tub or pool use. An appointment will be made prior to you leaving the hospital to follow up with your surgeon or advanced practitioner in the next week. Additionally, we ask that you make an appointment with your cardiologist in the next month. A referral to cardiopulmonary rehab will also be made once you are discharged that will help monitor your blood pressure, heart rate, and rhythm while strength training and increasing your cardiovascular health. FMLA paperwork can also be completed with the expectation that most patients are out of work for 4 to 12 weeks, depending on the type of surgery you had.
In conclusion, we hope you found this talk informative, and we look forward to helping you through the cardiac surgery process here at VCU Health. Thank you.